We're now live. You can go ahead.
Thank you so much for joining us today. I'm Lynda Hopkins, Chair of the Sonoma County Board of Supervisors, and this is our COVID update for Wednesday, July 28th. Before we get started, Gilbert Martinez from our communications team has a brief announcement for our Spanish-speaking viewers. Gilbert?
Buenas tardes y bienvenidos a la sesión informativa organizada por la supervisora Hopkins y la doctora Mase. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con Supervisora Hopkins.
Thank you so much, Gilbert. First, we are pleased to say that we have some good news to share today. More than 300,000 of our county residents are now fully vaccinated, and 335,000 have received at least one dose of a COVID vaccine. That means that we have now surpassed the 70% mark of our eligible population that is fully vaccinated. This is truly great progress towards achieving our critical herd immunity. That said, we also have some very real concerns right now because we are seeing a surge in COVID cases, a surge driven in large part, by the highly transmissible Delta variant. As Dr. Fauci, Governor Newsom, and President Biden and our county public health officials have all said, this is largely a pandemic of the unvaccinated. We all need to adjust and work together to lessen the risks and to get this virus back under control. That includes wearing masks when out in public, even if you are fully vaccinated. I know that's difficult to hear. Many of us were hoping that we were done with masks and with social distancing and that the worst of the pandemic was behind us. But even though we feel like we're done with COVID-19, COVID-19 is not done with us. And the truth is that we are no longer facing the 2020 version of this virus. We are facing a much more aggressive and contagious version of COVID. And just as the virus has adjusted, we need to adjust as well. We all need to adopt safety measures such as wearing masks in public to get this virus under control. And if you are still waiting to get vaccinated, this is the time to get that first shot to protect yourself, your family, and your friends, and your community. We also urge everyone attending the Summer Fun Fest that opened today, July 28th, at the Sonoma County Fairgrounds, and those who plan to attend the 25th annual Lazy Bear Week in Guerneville to please wear a mask. The county fair was canceled last year because of the pandemic. The modified version of the fair will be called the Summer Fun Fest this year, and let's make sure that we all have fun and in a safe way as we go out and enjoy that community event. The fairgrounds and the Sonoma County Medical Association are joining forces with the county's vaccination efforts by providing a free admission and a free ride ticket to anyone who receives a COVID-19 vaccine. The vaccines are available at the Jockey Club at the fairgrounds from 11 a.m. to 6 p.m. each day that the fair is open, which is now through August 8th. This is a terrific way to enjoy this fun event and to protect yourself and your community at the same time. Again, I just want to say it another time, county officials are urging everyone who attends the fair to wear a mask, especially when visiting any of the indoor venues. And now I'd like to go ahead and turn it over to Dr. Sundari Mase, our health officer, to share more details about the increase in cases and hospitalizations. Dr. Mase?
Thank you so much, Supervisor Hopkins, and to Paul and everybody else that is participating today. As Chair Hopkins emphasized, we truly are at a pivotal point in this pandemic. Even as we approach 80% of our eligible residents having received at least one dose of vaccine, our new case numbers are rising, along with hospitalizations. We are now averaging about 50 new cases each day, nearly 10 new daily cases per 100,000 residents. For comparison, in the middle of May, we were averaging about 3 new cases per 100,000 residents. So we're now over 3 times the daily case rate that we were seeing a few months ago. COVID-related hospitalizations also have jumped from an average of under 10 in May and early June to an average of more than 40 per day since early July, 4 times more. We also are seeing more COVID patients in our intensive care units, nearly all of them being individuals who are unvaccinated. And we also have seen a disturbing increase in the number of COVID-related deaths in our county. This troubling trend coincides with the arrival of the highly transmissible Delta variant, which the Centers for Disease Control and Prevention say is now responsible for 83% of new cases in the United States. As of yesterday, 188 cases of the Delta variant have been diagnosed in Sonoma County, which now makes the Delta virus or variant the most common one in our county. That is just the number that has been sequenced and identified. There are no doubt many more of Delta variant cases in our county. This variant poses the greatest risk to those who have not yet been vaccinated. Those who have not yet received the vaccine are much more likely to experience the worst outcomes, such as severe illness and hospitalization. Almost all our current COVID patients who are hospitalized in Sonoma County are people who decided not to get vaccinated. And all those in the ICU, the intensive care unit, are people who are unvaccinated. This is really tragic given how widely available the vaccine is right now and preventable if people get vaccinated. But we also know that we're seeing an increase in the number of people who are testing positive even though they are fully vaccinated. And this is causing some concern, particularly within our older population. The fact is, if you're vaccinated, the risk of contracting COVID is still very small. But with the Delta variant, the evidence is showing that there is indeed a greater risk of testing positive. How much the risk is not clear, but we know that the Delta variant is at least 60% more contagious or infectious than earlier versions of the virus. That said, what remains true is that those who are vaccinated still have a strong protection against the very worst outcomes of COVID, including hospitalization and death. In many cases, when someone who's vaccinated tests positive for COVID, including with the Delta variant, they're asymptomatic and they experience no long-term health impacts. This means they have no symptoms, or they might have very mild symptoms. Nonetheless, we are all vulnerable to passing along the virus, whether we're vaccinated or not. And we are all responsible for protecting our population, including those who are not able to get vaccinated, either because they're immunocompromised or they have some underlying medical illnesses, or because they're under age 12 and not yet eligible and not able to get the vaccine. That is why the County of Sonoma joined 6 other Bay Area counties a few weeks ago in strongly recommending that everyone, vaccinated and unvaccinated, wear masks in indoor public settings for everyone's safety. That includes grocery stores, retail stores, theaters, family entertainment centers. The Centers for Disease Control and Prevention issued similar guidance yesterday, recommending that both vaccinated and unvaccinated people wear masks in public indoor settings in areas that are experiencing substantial or high transmission rates. We support this new guidance by the CDC, and we are actually in that group that is experiencing substantial or high transmission rates at this time. That is also why Governor Newsom announced Monday that California will require all state workers and workers in healthcare and high-risk congregate settings to either show full proof of vaccination or be tested at least once per week. Newsom said the state needs to take this step to slow the spread of COVID-19 and get the upper hand on this pandemic. Governor Newsom is absolutely right. Because the Delta variant is so transmissible, we will keep stressing the importance of masking. That is why we're encouraging everyone attending public events this week, such as the Summer Fun Fest at the Sonoma County Fairgrounds and the Lazy Bear Week in Guerneville, to wear their facial coverings, to avoid large, dense gatherings, and to get vaccinated first and foremost. We still have work to do, and we still need to take care of one another and be safe. We know wearing a mask isn't fun, but we urge anyone attending these and other events to be safe while enjoying the food and entertainment. I would now like to turn this over to Dr. Urmila Shende, our vaccine chief, to talk about our vaccination efforts and testing.
Thank you, Dr. Mase. As Dr. Mase said earlier, we're making progress on vaccinations. The number of residents getting shots has slowed everywhere, including here, but we still are averaging about 1,000 doses administered per day. As Supervisor Hopkins noted, more than 300,000 county residents are now fully vaccinated, and more than 335,000 residents have received at least one shot. That means 70% of our eligible residents 12 years and older are fully vaccinated, and 78% have received at least one dose and are partially vaccinated. 52% of our children aged 12 to 15 have received at least one dose, and 43% are fully vaccinated. All that has happened since vaccines were approved for that age group very recently on May 12th. We're working tirelessly to reach out to those who have not been vaccinated. The vaccines are safe and they're effective. The county is excited to help make vaccines available at the Summer Fun Fest that opened today at the county fairgrounds. This is an example of how we are now making vaccines as convenient as possible where people are and making it possible for residents to enjoy this fun family event and protect themselves against COVID-19 at the same time. We encourage parents to take advantage of this opportunity to get their eligible 12 to 15-year-olds vaccinated before school reopens next month. We also want to emphasize the importance of testing, especially given the Delta variant. Awareness of the Delta variant is contributing to a large jump in the number of Sonoma County residents who got tested at pop-up sites. 1,150 tests administered in the past 2 weeks compared to 575 in the previous 2 weeks. Testing is widely available in the county from a range of providers. The Department of Health Services is working with providers to make testing available in more parts of the county. I'd like to also stress that if people have very mild symptoms, they may think it's because of allergies or simply because of a cold, it's worth getting tested because if it is Delta, it could be quite contagious, as we know, and could be passed on to more vulnerable members of our population. More information about testing is available at socoemergency.org. One reason testing is so important is that 30 to 40% of people who have COVID-19 have mild or no symptoms, but they can still pass it on to others who might not have the same mild response. The CDC estimates up to 60% of infections are transmitted while individuals are asymptomatic or without any symptoms. I'll now turn it over to Kate Pack from our EPI team, who will show and discuss some more slides. Thank you.
Thank you, Dr. Shende. I will pull up the slides. And Dr. Mase is going to begin with the presentation.
Yeah, great. Thank you so much. I just want to go over some of the basic metrics that we're seeing that we talked about. As I mentioned earlier, the number of new cases per 100,000 residents per day has risen to 9.5, actually closer to 10 new cases per 100,000 residents per day. And our test positivity also continues to rise. As you can see here, our overall test positivity has now risen to 4.4% and 5.7% in the lowest HPI quartile. And as we discussed earlier in the lower left, COVID-19 hospitalizations are elevated but stable with an average of 42 per day. That's the same as what we were seeing last January, well, February and end of January. 15 people have died from COVID-19 since June. And again, this has pretty much been in unvaccinated individuals that we're seeing hospitalizations, ICU stays, and deaths. Next slide, please. This, I think, is the most remarkable slide to note. And Kate, if you could just put the arrow on the blue line. Thank you. The blue line is our case rate in vaccinated, fully vaccinated individuals. As you can see, it's gone up a little bit, but we're still at only 4.2 new cases per 100,000 per day in people who are fully vaccinated. Now, if you take a look at the red line or the orange line, in the unvaccinated, it's creeping up and it's actually at 22 new cases per 100,000 per day. This graph alone is probably the best evidence and data to support vaccination right here, that we have 5 times the number of cases occurring in the unvaccinated population. And if I can just add, this is due to the fact that unvaccinated people are hanging out together. They are going to gatherings together. Generally, they make up the same households and the same friend groups. And so the Delta variant especially is highly transmissible and sees any opportunity to transmit from one person to another and readily does so much more than previous variants amongst unvaccinated persons. And then when this happens, you can see more and more cases occur in our county. So there's greater community transmission also in public venues, potentially in stores, potentially in other indoor settings, transportation. You know, there's going to be more cases out and about, people who have COVID. And then fully vaccinated, vulnerable people are more likely to be exposed to COVID. Next slide, please. So I'm going to turn this over back to our epidemiologist, Kate Pack, to take it from here, to go a little bit more into details of what's happening in terms of our post-vaccination cases.
Hey, thank you, Dr. Mase. So we wanted to look a little bit more closely at the post-vaccination cases that we have seen in our county. So what is a post-vaccination case? To qualify as a post-vaccination case, this means that it's individuals who are fully vaccinated and they receive a positive PCR test 14 or more days after they complete their vaccination series, whether that's a 1-dose series or a 2-dose series. It's really important to note that post-vaccination cases are to be expected. No vaccine is 100% effective, and a small portion of people may still get infected with COVID-19. However, evidence suggests that vaccines help reduce the severity of the illness if you do become infected. And the CDC recently stated that vaccination can reduce the risk of symptomatic infection 7-fold and the risk of hospitalization 20-fold as compared to if you're unvaccinated and become infected with COVID-19. So how many post-vaccination cases are occurring? Statewide in California, less than 1% of the fully vaccinated population has been infected with COVID-19. So that's about 21,000 people out of 20.9 million fully vaccinated individuals. In Sonoma County, we're seeing a similar trend with less than 1% of our fully vaccinated population becoming infected with COVID-19. So 500 post-vaccination cases have been identified to date out of over 300,000 individuals who are fully vaccinated. As was mentioned earlier in the briefing, we do have Delta, the Delta variant in our community. And we know that Delta is over 60% more transmissible than other strains of COVID-19 and contains 1,000 times the viral load. So what does this mean? This means that COVID-19 has the potential to spread more quickly and to more people in our community. And it means that we may see increases in our post-vaccination cases as transmission in the community becomes more widespread. And we know that even post-vaccination cases can carry high amounts of viral load when you have Delta present in the community. And that means that fully vaccinated individuals could possibly transmit COVID-19 to others. This chart shows the proportion of cases by week that have been post-vaccination cases. So in the last 3 weeks, about 22% of the cases have been post-vaccination cases. And I wanted to just look through briefly some of the characteristics of those cases. Again, this is a very small proportion of our cases, less than 1%. But among those 500 cases, these are the trends that we're seeing. So looking from January 2021 onward, about 5% of the total cases have been post-vaccination cases. And we've seen that these cases are more likely to occur in older adults. We know that fortunately, more of this population is fully vaccinated. So that's part of the reason we're seeing a higher proportion of post-vaccination cases here, just because most people have been vaccinated. And there's also some evidence of waning immunity with age that may make somebody a little bit more susceptible to infection. Looking by race ethnicity, post-vaccination cases have accounted for a greater proportion of cases among Asian and white residents. Again, these groups are more fully vaccinated than some of the other racial ethnic groups in our community. Looking at the symptomology of the cases, 74% of the post-vaccination cases where we have information about symptoms have been symptomatic, and the majority of these, 92%, had mild symptoms. And just looking at the trends in our post-vaccination cases versus our unvaccinated cases, we've seen that a lower proportion of the post-vaccination cases have been symptomatic as compared to unvaccinated cases.
Hey, this is Paul.
Yeah.
Would you mind slowing down just a little bit to help our interpreter?
Oh, apologies.
This is great information, but it'd be just to help her catch up. Thank you.
Thank you for the reminder. And in looking at our hospitalizations and deaths, as Dr. Mase mentioned, our hospitalizations remain elevated but stable with an average of 42 hospitalizations per day over the past 2 weeks. Looking at people who are currently hospitalized for COVID-19 symptoms, 83% of those hospitalized for COVID-19 and 100% of COVID-positive ICU patients are unvaccinated. All fully vaccinated hospitalized patients have had other significant underlying conditions to date. And the vast majority of our deaths, all but 2 deaths, 99.4% have been among unvaccinated individuals. The 2 individuals who were fully vaccinated and passed away from COVID-19 were both over the age of 90 and had other significant underlying conditions. Looking at trends in the age of our hospitalized patients, we're starting to see more younger age groups being hospitalized. So this chart is looking over the course of the entire pandemic. You can see this dark blue line here is the 65 plus age group. Over the course of the entire pandemic, this age group tended to account for the majority of the hospitalizations. With greater vaccination, we've seen hospitalizations in that age group decline significantly. Looking, however, at from April to June of this year, we can see a change in trends. So this light blue line here is the 50 to 64-year-old age group, which now is accounting for the majority of our COVID-19 related hospitalizations. We still do see the 65 plus age group here, and we recently saw increases, although these have plateaued a bit, among the 18 to 49-year-old age group. We know that the younger age groups have lower rates of vaccination and that the majority of our patients hospitalized are unvaccinated. So we are starting to see this shift towards younger age groups. So what we can kind of conclude from this data is that vaccination reduces the risk of symptomatic infection and greatly reduces the likelihood of hospitalization or death. Our community transmission is widespread, and we know that Delta is present. So the vaccinated people may become infected with this widespread transmission. However, the research evidence suggests the majority of these cases will be mild, although the immunocompromised and the elderly may still be at risk. So recommended health precautions are that full vaccination is the best protection, particularly against severe outcomes from COVID-19. Our community transmission is widespread, and it's important for both vaccinated and unvaccinated individuals to mask indoors and to continue testing. If you're fully vaccinated and you have symptoms or you think you may have been exposed to COVID-19, you should get tested. So I don't know, Dr. Mase, if there's anything else you would like to add around this data.
Yeah, thank you so much, Kate. I think you hit the main messages. Again, I just want to underline the importance now for us, every single one who is either partially vaccinated to get their second vaccine, for people who are not vaccinated yet to begin the process and get their first and second vaccine. If they're getting a 2-dose vaccine or get the 1-dose vaccine. At this time, you will protect yourself, your family, your community, and allow us to get back to normal faster if you get vaccinated. Thank you.
Well, thank you all. I'd now like to introduce Dr. Gary Green, who's an infectious disease specialist with Sutter Health here in Sonoma County. Dr. Green, thank you for joining us. Would you like to share some of your observations about the situation today? Dr. Green, you're muted. Let me ask you to see if you can, if you're available to join us. Okay, I know he was on another call, so he may have been called away. But
I am here, Paul.
oh, great. Do you have time to share some of your thoughts with us, Dr. Green?
Yeah, here, there we go. Start my video back on. So I'm definitely seeing many more patients in the hospital. Some are very young. I've only had one vaccinated person who needed oxygen in our hospital so far. So 99.9% are unvaccinated. And what I'm noticing is I do notice that, especially in the Latino population, there is an element of remorse about not getting vaccinated. There's a sense of regret, and they seem pretty motivated to not only get vaccinated after their illness, but also to share that with their family. And most of them were just needed more information, or most of them had concerns, but they really weren't resistant. So, you know, the message we've been giving in the Sutter system is that we're so fortunate to have the 2 best vaccines in the world, and that now this is vaccine preventable. And my personal take as a physician in the community is that it's really tragic for someone to come into the hospital who's unvaccinated, who has made that choice or not had the access they needed, and now to have such a severe illness. It's almost like, you know, we shouldn't see measles anymore, you know, with such a good vaccination, and we shouldn't see COVID in the hospital anymore either. So just getting the momentum around the vaccine would really be imperative. And I think that there's a lot of people who are on the fence, and I still think there's a lot of good work we can do to kind of turn the corner on it. The other message that I've sort of told our physicians is when you have a more transmissible variant, it's going to take more vaccination to get to herd immunity. So it kind of ups the game a little bit.
So just one question. There is a lot of concern out there these days about breakthrough cases. It sounds to me like you're not seeing any severe outcomes when and if that does occur among vaccinated people.
No, we're seeing some mild cases in the ambulatory setting and some mild cases in the hospital, but certainly no one hypoxic. We're not seeing a lot of pediatric cases at all. I mean, I haven't seen one myself, but I've heard about a few, but they've been very mild and very rare. So I think breakthrough cases for me, the CDC mentions that it's about 0.8% of people who've been vaccinated can have, 0.8% of those hospitalized may be a breakthrough case. And I think it's clearly less than 1% so far in our hospital.
Okay, well, thank you very much. What sounds like the message today is truly that the Delta variant is real, it's aggressive, and this is more important than ever to get our vaccines.
Yeah, Paul, if I could just give one anecdotal thing,
Sure.
is I was in the hospital till about midnight last night, and I was trying to keep a 29-year-old healthy person off a ventilator. I never thought I'd see that.
Well, it's truly scary. It is tragic, as you say, that particularly given that the vaccine is so widely available right now. And we're even offering it as free admission to the county fair. So we hope people take advantage of that. Well, thank you all for this COVID update for today.